And finally, our third patient perspective speaker is Tracy Zigman. She has a slightly different view. Her daughter Isabella was diagnosed in December 2014 at the age of 5 with nephrotic syndrome, minimal change kidney disease. Tracy's family's personal experience with the mystery of diagnosis and the challenges of pediatric treatment, including the behavioral impacts, inspired her passion for raising awareness in hopes of gaining early detection, expanding patient and public education, connecting with other parents, accelerating a cure, and increasing donor support. She is an active ambassador for the Nemours A.A. DuPont Children's Nephrology Unit. She's also my next door neighbor, dear friend, and we have watched Isabella go through being sick and now being well again.
Good morning, everyone. Good morning, everyone. First, I'd like to see, if I may, how many patients we have in the audience today. Anyone? I'm going around the room. Wow, okay. Any with pediatric family members, chronic kidney disease? No? Okay. So our only daughter, Isabella, aka Izzy, we did get the pictures up, was diagnosed in December 2014 at the age of 5 with nephrotic syndrome, minimal change kidney disease, a kidney disorder that causes the body to excrete too much protein in the urine. With a family absent of kidney disorders, my husband Tony and I were stunned by the diagnosis. As a result, we have become actively involved in advocating for the kidney community with a mission to learn as much as we possibly can. Thanks to the amazing Bill Murray for referring me to share our journey, and to Tim Gibbs, my neighbor, for the superb intro, especially to Claudine for having me here today. And I look forward to participating more in the future. So to tell you a little bit about Izzy, Izzy's now 7. She was diagnosed following a 3-week-long weight gain of about nearly 20 pounds, which, to be honest with you, we thought was a growth spurt. You know, when you see a child every day, you don't necessarily notice how dramatic the weight gain is. So let me take you back just the days prior to diagnosis. It was holiday, post-Thanksgiving, and pre-Christmas. You know the routine: parties, activities, shopping, travel, and all focused and centered around what? Eating, food. We started to notice more and more weight gain, and I vividly recall standing on the playground with her kindergarten teacher and mother of 3, asking her if she thought Izzy was gaining weight. Because, of course, Tony and I had talked about it, but starting to ask for outside input from folks who saw her on a regular basis. And she said, it's normal, probably just a growth spurt. I conceded, being a first-time mom, and just assumed I was being a worrywart. That is, until sudden extreme edema occurred overnight and just 3 days prior to Christmas 2014. I recall the events vividly again. The day before the diagnosis, we enjoyed a family tradition of Christmas at Longwood Gardens, along with a quick dinner of hot dogs at Johnny's on 202. And for anyone who knows hot dogs, absolutely the worst, right? Full of sodium. We had no idea. We do now. She hasn't had one in a year and a half, by the way. As we ventured through the display of lights, Izzy quickly grew fatigued. She didn't want to walk. She whined a lot. Now, here's the challenges with pediatric, is you don't know. They don't know if it's the medication, if it's an ailment, and we still continue to go through that, or if it's her age. She's 5 years old. We thought she was just being cranky. It was a Sunday night, close to the holidays. My husband carried her on his shoulders and piggyback through which was no small task, even for him, a 6'2" ex-football player. She was 62 pounds. The next morning was a manic Monday. We awoke to Izzy so swollen that you couldn't see the veins or bones in her hands or her feet, and her eyes bulged so much it looked like she had another eyeball behind her eyes. The parent guilt finally set in. We instantly called her pediatrician, raced to his office. The moment he saw her, knowing her very well, he said he was calling Nemours. It's either her kidneys or her liver, he told us. What? We actually thought it was an allergic reaction. We never thought it was going to be an organ. When we got to AI, the ER was flu-stricken. It was, that time of the year. So they took us, fortunately, back immediately for examination, and hours later, we were diagnosed with nephrotic syndrome. The days that followed were cautious, as though she was a newborn. She was medication treated and controlled with prednisone. I call it the evil wonder drug. As well as Lasix, Zantac, and urine checks daily. The side effects were daunting, and again, mixed with a 5-year-old. So we weren't sure what. I hadn't really been exposed to prednisone or taken it myself. Neither had my husband what was the 5-year-old and what was the drugs. It worked, though. That's the key. So, hold on, lost my thing. We shared our experience verbally with a few friends and family, hoping to gain support. And, well, the rare disease ignorance, I call it, set in. Are you sure it's not a kidney infection? Someone asked me. It could be worse, someone said. Dumbfounded by these comments, my husband and I kept to ourselves for months. After caring for Izzy as best we could, keeping only those who needed to know in the know. Then we started to notice the comments directed towards Izzy, and I'm sorry if I'm going to get choked up. Look at how cute her chubby cheeks are. So this is Izzy. This is before. This is on prednisone, and then this is just a few weeks ago. We started to notice comments. So she's gained a few pounds. Someone was saying this. She's standing in my presence saying it to me. And then we had comments about her being tired. So we're a family of healthy eaters. We're very physically active. We were panic-stricken by, the food, salt, protein, dairy, exhaustion. It was the holidays, or just post-holidays. Izzy would eat a whole dinner and then ask for another main course. So ask for another whole hamburger, not more chips or more fries. How do we explain to a 5-year-old that she's not really hungry? It's the drugs. It wasn't easy. It was a fight. We spent hours researching online. We suffered colds, impetigo, styes in her eye, you name it, she got it. The immune system suppressed. We couldn't wash our hands enough, and we just wanted to stick her in a bubble. She was on prednisone for 9 months. We tried 3 times to wean her off, only to find protein spill into her urine within days. In July 2015, I finally had a meltdown in her nephrologist's office, pleading to try something new. And it could have been the fact that my husband was the only appointment that he couldn't attend. So I was there by myself. We just simply needed relief from the steroids. He shared a lot of our medication options, including clinical trials. And I will say one of the things I admire most as a patient, a caregiver of a patient at Nemours, is they are very transparent, even with children. So any discussions about Isabella is always in the room, and I've always admired that. We decided on CellCep, and I just want to show you really quick. So this is the first day we got the medication. This was the side effects that were in the box. Now, I'll tell you, prednisone's wasn't this big. This scared the you-know-what out of me. This is almost poster size, wouldn't you say? Front and back. Can't wait to start this drug. So around the same time, Dr. JJ introduced us to the NephCure Foundation, which is how I met Bill. And with their support and encouragement, we came out to our expanded family and friends. I did, on Facebook. The outpouring of support was overwhelming. We met families within 2 degrees that had nephrotic syndrome. We met other nephrologists. We met others affected by kidney disease. Even one, a friend of a friend, again, I say Delaware has 2 degrees. There's no 6 degrees here. Friend of a friend had 2 children with nephrotic syndrome. Interesting story there. And I thought perhaps a medical phenomenon. I spent hours talking with many directly and personally, attended all the events at Nemours that I could, and I became a sponge. So much so that Dr. Zaritsky, who couldn't be here today because he's on his way to Brazil for the International Nephrotic Syndrome Conference, told me to stop looking up, stop reading, take a break, which I did. But as many have said before me, awareness is key and education is crucial. I think one of the most challenging comments we've also got to is that it's nephrotic syndrome, it's not a disease. So define disease for me. And what difference does it make if it's a disease or a syndrome? Over the last year and a half, we've become avid volunteers and fundraisers for NephCure Kidney International, where I captained Team Izzy, raising in excess of $10,000 for 2 walking events over the last year. We helped organize, We helped organize the inaugural Wilmington NephCure 5K walk run in Rockford Park, in which Bill was very involved as well. And we raised for the inaugural walk over $12,000. We had 130 participants, including 9 patient families, and it was raining. I'm also an active ambassador for Nemours, connecting new local patients and staff, and I do the same for NephCure. They reach out if they have someone new move to the area. I've also worked with Dr. Joshua Zaritsky and Chrissy, his PA, to present a MIDI education program for Izzy's first grade class at Ursuline Academy last April. And the program really just encouraged, again, kidney health and raised awareness amongst her classmates about her condition, with the goal to prevent any bullying due to her fluctuating exterior experiences and some behavioral changes. Dr. JJ and team also created a cookbook, Eating Well with Kidney Disease, in which Izzy's photo is captured in the cookbook. She's super excited, and 3 of her recipes. Pretty phenomenal, I thought. And I'm getting close to closing, so if anybody's... Tim's over there. We're grateful that there are medications to manage, and certainly know it could be worse. But it doesn't make it any easier as a parent with all the challenges today holds on a daily basis. She's our one and only, and she's only 7. She doesn't understand. She's become one of the most compassionate and empathetic children I know, and I give Nemours a lot of gratitude for their patient-centered approach. We spent more time, I felt, in the first few months at AI than we did on the playground. We worry how the medications will affect our future and what the future holds. The mystery is pretty disturbing, and research is key. In fact, just last week, I received the most profound question from Izzy and the first time ever on the way to school. Mommy, when will I grow out of nephrotic syndrome? I wasn't ready for it. I answered, and just this week, yesterday, in fact, she had her 7-year-old wellness exam, and in 1 year, she lost 5 pounds, and she grew 5 inches. Very exciting. Thanks. Our personal family's experience with the mystery of diagnosis and the challenges of pediatric treatment, including behavioral impacts, are what has inspired our passion and our drive for raising awareness with hopes of early detection, expanding patient and public education, connecting with other patients, finding the cause, accelerating cure, and gaining donor support. Let's do this. Thank you.